call the honourable member for Dunkley.
Thank you, Deputy Speaker. Can I start by joining others in this place in thanking all of the medical staff and people who have supported medical staff throughout the pandemic, from nurses doing COVID testing, the administrators helping the nurses as we go through the mass testing sites to have everyone registered for their testing, through to the pathology service who have processed the tests, to the doctors and the nurses and the administrators in our hospital systems who have been under such pressure dealing with COVID, to the GP clinics and the people that work in those clinics, be they the GPs or the practice managers or the people at the front desk. You have been the front line of our fight against COVID and will continue to be as we open up. And all of those people deserve the support of their government, not just words of thanks, which I'm sure are welcome, but the funding that's needed to make sure our public hospital systems can continue to operate, not just for the sake of people who have COVID, but for everyone else that needs to access a public hospital, which is overwhelmed often at the best of times, but certainly has the extra burden of COVID. For the Medicare system, for the GPs who are now seeing people for their health checkups, for their ongoing treatment, for getting the vaccine, sometimes for then treatment of having COVID. Their workload has increased, but sadly we haven't seen enough funding guaranteed going forward to help these people. This bill brings forward some changes that are welcomed, but it doesn't address some of the specific issues that we have, that Australians have in outer metro seats like my seat and my community of Dunkley, regional and rural areas, in accessing healthcare and in particular in seeing a GP. Tightening access to regional bulk billing incentives that the government has brought in is a policy from a Morrison government that's made regional GP shortages worse. And we feel those shortages in outer metro seats like mine. It's not just in the regions. And there's also the impact of the government's 6-year freeze in Medicare rebates and the decision back in 2014 to abolish Healthcare Workforce Australia, the consequences of which we are still feeling today. This is the time that the government should be investing in Medicare and delivering more services to people, not less, more services. October is Breast Cancer Awareness Month, and the Breast Cancer Network of Australia and other organisations dedicated to helping women and the smaller number of men who have breast cancer have been ringing the bell loudly and clearly for at least 18 months now about drop-off rates of women getting checked, having mammograms, and the consequences of later detection of cancers for survival rates and for the sort of treatment that you have to go through. There is so much to be done in the healthcare system on top of COVID, and we can't afford a government that is not just asleep at the wheel, but has failed to look after people in their time of need. You know, if we can't properly train up enough people to be GPs in Australia, if we can't devise a system that incentivises GPs to get to outer metro seats like mine, then we're going to continue to be reliant on GPs coming to Australia from other countries. And we've seen something like this pandemic really impacts the ability for GPs to come from other countries. And we welcome medical practitioners from around the world, and they bring so much to the profession but also to our community. And we of course should continue to actively recruit people from all different parts of the world, and the best and the brightest, to come and work in Australia. But we have to skill up Australians. We have to give Australians the opportunity to also be the best medical practitioners that they can be. And we have to have a system that doesn't make it almost impossible for GPs in outer metropolitan seats to be able, GP clinics to be able to recruit GPs. That's why Labor established a Senate Community Affairs Reference Committee inquiry into outer metro, rural and regional GPs and healthcare services. And that inquiry is also going to consider the performance of programs such as the bonded medical program. There is a crisis in outer metro seats. There is no doubt about it. There is a crisis in being able to recruit and retain appropriately trained GPs. It is unfortunate that we have to have a Senate inquiry to push for reforms in this area, because it should just be something that is done as a matter of course by a good government. But it hasn't been done. The inquiry happening in the Senate, I understand, has heard from numerous stakeholders. If you look at the committee's website, it says that there's some 40-odd submissions which have been received so far, and I thought it was a bit strange because I've made a submission on behalf of my community in Dunkley and it's not on the website. So my office contacted the committee today. Apparently there are so many submissions to this inquiry that they're overwhelmed trying to get them all up onto the website. So those 43 or so submissions that are on the website don't reflect the huge number of stakeholders, MPs, local councils, medical colleges, individuals, GP clinics who have made submissions. And the point of this inquiry is not simply to hold an inquiry, it's to get practical, positive solutions to make sure Australians have access to quality health care regardless of where they live. So I've made a submission on behalf of Dunkley, and I encourage everyone who lives this issue or is concerned about this issue to get engaged in the inquiry. You know, this issue was first brought to my attention shortly after I was elected in August of 2019. Dr Chung and Lucinda Wilk from the Total Care Medical Group in Frankston came to me. Dr Chung, 72 years young, wants to retire. He wanted to retire in August of 2019, but he couldn't and still can't recruit enough replacement doctors to be able to do so. I've raised this issue with the minister, I've raised this issue in the parliament, but the barriers to employing doctors at Dr Chung's clinic remains, and he continues to work. In November of 2019, I met with Rachel Hadzopoulos from the St Mary Medical Centre in Carrum Downs because, again, of the serious barriers to employing new doctors that clinic has been experiencing and other clinics associated with it has been experiencing. As Ms Hadzopoulos said to me at the time, it's a common problem across bulk billing out of suburban clinics. It was then, it is now. And Ms Hadzopoulos has put in a submission for the committee, which I helped her to submit. Recently I had a roundtable discussion with local clinics and Labor's Shadow Minister for Health. Here's a summary of what was clear from that roundtable. As an MMM1 location, the Dunkley electorate is not listed as a distribution priority area. From 2022, all doctors require a 3GA program placement. However, there are no programs available in the local area. The only program is the AGPT, which has been closed for several years in metropolitan locations. Health workforce certificates are not granted in MM1 locations, resulting in local clinics being unable to recruit an international medical graduate. Clinics with GP shortages have used locum doctors to fill the gaps, but these placements are only available after they've passed their FRA CGP exam and for a maximum of 6 months. So patients and clinics are consequently subject to frequent GP changes, which is not good for people who need ongoing care. Multiple GP clinics with active patient lists of over 6,500 have reported as having only one full-time doctor with some part-time assistants to manage their patient load. Additional pressure is being put on hospital emergency departments. Patients who can't be seen by a doctor in a timely manner are being referred to hospital for primary care matters. It's just not good enough. It's not good enough in my community in Dunkley. It's not good enough across Australia. We are constantly putting out the positive message to people to look after their health, engage actively in preventative health Go and see your doctor if you have concerns about anything. Get tested. Carry out courses of treatment in the way that they are prescribed to you. It's really, really hard for people in outer suburban suburbs who rely on bulk billing GP clinics if they cannot engage a GP to be able to help them do all of those things. It shouldn't matter what your socioeconomic status is. It shouldn't matter where in Australia you live. You should have access to superb, top-quality care, and you should be able to get that access at a bulk billing GP clinic. And when the clinics in my electorate can't recruit doctors to work and stay at their clinics, it is undermining the care that's given to often the most vulnerable people, and it's not good enough. I call on the government to actively participate in the Senate inquiry, to look for positive solutions and to implement them. It's actually urgent. It really needs to be done. Thank you.